My name's Faye, I'm a domiciliary optometrist and I work for the Outside Clinic. So I'm going to be going through some of the equipment that we use when we're testing in someone's home. It all has to be small enough that it can fit inside a bag so that we can take it into someone's home. Our trial sets are condensed because a full trial set is a little bit cumbersome. We choose if we want plus or minus sil. The stronger lenses are condensed so you go up in diopter changes instead of 050s. Just makes it easier rather than bringing a massive trial set out. Obviously a reading card. We've then got our trial frame to go with that. In order to actually test and use a chart, we need to test at an appropriate distance. We normally use 3 meters because we can use that in someone's home. So we've got a test chart that's adapted for that. We use an iPad that also has a remote control, so we can use that from the other side of the room and we're not having to go backwards and forwards. We've loads of different settings on the tablet for what we can use as targets, but obviously the most commonly used one is going to be a basic Snellen chart. We've got different sizes we can scroll through. Again, that can be controlled by the remote. We've also got a normal fixation spot, just a target, fixation disparity, duochrome, and then cross-sil targets on there as well. We use Fundus photography, which is really great. So there's a portable Fundus camera that you can use. These are amazing because you can connect them to your tablet. You can monitor people's records. If someone's had a test with us previously and we've got prior Fundus pictures, we can compare and we can monitor things over time. Having the pictures in front of you is always really useful. It also reminds patients of what a test is like when they're in practice, because often if they're in a store, they're going to have Fundus pictures taken. They'll often remember that and it'll sort of remind them of the fact that actually this is just as good an eye test in a store, but it's from the comfort of their home. If I can ask you to hold your hand just over your left eye for me so it covers it perfectly. And if you look in here, you should see a little green flashing light. That's perfect, thank you. There'll be a bright flash. Fab. Beautiful. We've got a tonometer, so we use an eye care. It's a lot lighter, it's more portable, it's a lot more comfortable for our patients. You don't have to use any drops, so you're not having to carry anything extra around with you. You're obviously just using your probes and taking them as and when. It's a lot easier for patients when they're laying down and it's just much nicer to use. We've obviously got a ret and ophthalmoscope, so I'm hoping people will already know what they're for. They're useful obviously for testing at home. A lot of our colleagues like to use a panoptic ophthalmoscope. They give you a nice wide field of view. It's nice to have a few different ways of viewing someone's fundus depending on what you're looking for. We use a portable versimeter, which is really handy. They're dead simple to use. You've got a little shelf there to pop your spectacles on, the same as you would use any manual versimeter. Pop the glasses in, line them up, and then read off what they are. We use a lot of magnifiers with our patients because we've got an older demographic. They're more likely to have visual issues. Magnifiers are great. A lot of our patients won't want referring for problems. They won't want referring for their cataract. They'd rather just manage with their vision as it is. And magnifier is a really useful tool to be able to sort of show them what their vision could be. It means that they can still read their own mail, for example. Anything that's going to make their life a little bit easier. We also have portable slit lamps. These are really useful for any anterior eye examination. A lot of our patients will have dry eye problems. Any anterior exam is really useful with this. They're dead simple to use, dead lightweight. We've had a few colleagues mention that they've sort of seen things like pseudoexfoliation, which you'd have no hope of seeing without it. So if we've got a patient who we need to perform fields on, the simplest way to do that is confrontation. Most people will have seen a confrontation stick in the past. You've got big end, little end. Those are really great just to get any sort of gross field defect. A lot of our patients will have had strokes in the past, so checking that is obviously essential. If anyone needs anything further, obviously we can refer them for further field testing if we think that it's required. Red and green goggles we also have, we can use those for fixation disparity. Any sort of binocular thing that we're wanting to check, we can use those for. A number of our patients will have quite severe hearing impairments, so quite often it's useful to have a different way of communicating with them. We developed some communication cards which are really useful. They'll have regularly used questions. It's all sort of in order of how you do it throughout your test. So you can flick through that, and a lot of them mostly are yes or no. And it just means that we can get a concise history and symptoms. We're not missing any information just because we're having issues communicating with them, so those can be really useful as well. We will quite often use matching charts with our patients if they've got any communication issue that they can't interact with us as easily. These are often really useful if you've got someone who's non-verbal because of learning difficulty, or if they don't speak English. They can obviously just point to these. The last thing we have is just the tablet for our records. All of our patient records are stored on the tablet. We input them bit by bit. Everything on our record card is all on the same screen, which is really useful. One of the features that we have on our records is that everything is lit up in red, as you can see around each box. Once you click on a box, it'll give you pre-filled parts to put into the record. You can change the preferences for what you want your buttons to be. If there's any additional information that you want to pop in, you can type it and it'll normally come up with a little keyboard. Anything ocular health wise, we can also draw on the diagram, so we can add little drawings onto that as well. It's a really useful feature that it all shows up on red. Once you've filled that in, the red box will disappear. You can't progress to the dispensing screen on the next page without filling in each red box. It means that anything that might come up on an audit is accounted for. Even if you pop in a negative finding in there, that's absolutely fine. If there's a test that you don't think was clinically appropriate for you to perform, such as fields, you just have to put that you haven't performed it and why. We use card machines. These are all touchscreen. We do also have a little keypad that goes on top of it if we've got any elderly patients who would struggle with a touchscreen. It basically means that people aren't having to handle cash. It feels like it's a little bit more of a reliable service if they've got a card machine that they can use. We have tiny little printers. So we have portable printers. These are, again, patients love these. They go wild when you bring them out. So these are really handy to bring around with you. It means that you're following all of your NHS guidelines and all of your legal requirements to print off any paperwork they might require. We dispense our patients at home as well, so we needed a nice way of carrying frames to them. We use these frame cases. They're expandable, so we can carry lots of frames. Patients love it. It's a little bit like taking out a magic trick when you do it. You get lots of oohs and ahs in the room. They think it's amazing that you can fit so many frames in one place. It's nice that we can then give them such a large option of frames. They often think that they're going to be quite limited in what they can have, but because we've got so many available because of the space, it means that we can offer them a nice service still. So we often carry 2 bags. We'll normally have a different one for men and a different one for women. It means that we can give them a wider range of options.